to really frame the issue, I would like to start with Kathleen first. You know, as a former governor and executive secretary, I'd like to turn to you for your perspective, not only in terms of HHS and former governor, but also as the leader of the Aspen Health Strategy Group. You have 5 big ideas. Tell us about it.
Well, thank you, Victor, and it's great to have a chance to be here today. And I'm not only want to applaud the National Academy for the work you've already done, but for the work you're committed to do on this topic. I feel like I'm with an old friends and family group. I'm married to a judge. I spent a lot of time hanging out with important HHS leaders, including surgeons general and FDA commissioners, and I'm a recovering governor, so here we are.
You should be the president of the academy.
And Victor is on our health strategy group, I should say. The Aspen Institute Health Strategy Group has been together for a couple of years, and it is, as Victor said, co-chaired by Tommy Thompson and I. Tommy was a Republican governor, I was a Democratic governor. We both served as secretary of HHS, and so we are a very bipartisan group. There are 23 other leaders, health experts, economists, media folks, business leaders who come together and tackle one issue. And last year, the issue we talked about was the opioid crisis, which seems pretty prescient right now. And I think that this panel is indicative of our group coming at this from different lenses, and also indicative to me of the work that's needed across various sectors of our government and civil society to actually tackle this problem, which is getting worse as we sit here and speak. I think you've heard a lot today about various scientific discoveries and issues, various ways to approach this, but I just want to talk about the 5 things that are not new to our group, but we thought might be the most important and effective ways to move the needle, and then have a discussion with my colleagues. One is that we all felt we need to guarantee access to treatment. In a world where we have made, I think, a really important pivot from a criminal justice approach to substance use disorders and alcoholism and various kinds of issues involving substance use. And we know that mass incarceration and the criminal justice system has not solved the issues of either supply or demand or cured individuals. Treatment is essential. Victor's already said we only have 1 out of 4 individuals in treatment right now, so we have some real gaps, and there are ideas and strategies about how to deal with that. But we know medication-assisted therapy is effective. We know that there are various strategies that really can work, and our group, again, Republicans and Democrats alike, felt Medicaid expansion needs to stay in place. The Wellstone mental health parity provisions of private health insurance need to be reinforced and actually made fully effective, and we need to make sure that people have access to the treatment they need. This is a terrible time to back away from that, and engage physicians and prescribers across the board, changing reimbursement strategies, educating public, reducing stigma, but treatment is probably number 1. Secondly, it is critical that we address the issue right before us, which is overprescribing. There is no doubt in this country that opioids are prescribed on a much higher basis than any place else in the world, even though many other places in the world have relatively free drug access. We still are way over any kind of average. We know that there are some best practices around, and I assume Governor Baker is going to talk about some of the things that are going on at the state level, which are always well ahead of what's done at the federal level, but whether it's prescribing authorities that do a good job tracking, trading information, breaking down the silos, discussing the possibility of some mandatory prescribing limits, and looking at really the costs of the treatment that should be and probably appropriately could be shared with the manufacturers. As somebody said on the earlier panel, people have made billions of dollars selling opioids, and the taxpayer right now is picking up a large share of the treatment costs, and I think that's an appropriate area to look in the future. The third is just reinforcing the notion that this is a public health crisis. I know that the panel that Governor Baker serves on has asked for the national declaration that seems to be agreed upon by the administration. I don't think that's quite happened yet, but I think using all of the tools that we have to really focus on this and address it is important, and we need evidence-based treatment to be the guide going forward. We pretty much know what works. We know punishment doesn't work. We know mass incarceration doesn't work. Denying social supports to individuals who are trying to get treatment, to come forward, to have access is likely to be very counterproductive. Cutting off housing, cutting off food support, cutting off various kinds of social service support may be one step forward and 2 steps back if we really want people to come forward and access treatment. So this is a public health crisis and needs all the tools that we can muster in a public health crisis. Fourth is stopping the unnecessary deaths. Again, some states have taken a very impressive lead on this. I was recently with the governor of Pennsylvania, whose Surgeon General in the state has issued a unilateral prescription for naloxone. Everyone can access that prescription at any pharmacy at any time. We need more emergency responders to be equipped with life-saving drugs. We need to teach people across the board how to use life-saving drugs. But again, I think that states have done some pretty remarkable things. I know Massachusetts is right up there. And finally, just invest in science and knowledge. We know some things well. We don't know other things very well. I heard the discussion about treatment of chronic pain and what is effective. There are clearly strategies effective. I think at least what was shared with us over the course of this look at this disease is a lot of scientists who say we haven't done a long-term study of whether opioids are really effective treating chronic pain. We know they're very effective treating acute pain, but what is the long-term effect? What happens at the end of the day? We clearly need more research into a lot of areas, but that's one of them. Again, those are not new ideas, but we felt out of the range of areas that are out there and other people are working on, that these may be some of the most effective strategies to move forward.
Perfect. Thank you for really a great comprehensive set of reports.